so long ago, completing his message to the province as well, and checking in on how things are proceeding, and now engaging on a walkabout.
Yes, he's actually still inside this vicinity, but he's going to step out in a few minutes' time, and he's going to do a walkabout at this specific hospital. For a long time, Arabile, for the past 2 weeks, this hospital has received really bad images in terms of the cleanliness at this hospital. We saw a BBC report that showed dirty passages, dirty wards, with rats in some of the hospitals as well, this specific hospital specifically. And he has stressed the importance of making sure that hospitals are kept clean. He said that the issue of clean hospitals is not about the patients not throwing litter on the floor, but a dirty hospital is all because of mismanagement. So he emphasized that the MEC of Health has got to make sure that she employs capable managers that are able to make sure that hospitals are clean. He said that if a patient comes into hospital and it is dirty, automatically that patient is going to get sick. He also did emphasize the importance of every health worker right now coming together, doctors, nurses, porters, all coming together as a team to try and fight this pandemic. He stressed that this pandemic cannot be fought alone, that doctors alone can't do it, nurses alone can't do it. We need good leadership, concise leadership, and good management to make sure that hospitals are properly run so the pandemic numbers don't rise. So he's going to walk about in this hospital. I said to you earlier on, Arabile, that a certain part of this hospital is actually currently under under work. They're going to have a certain part of that hospital under construction and converted into a COVID ward. 72 beds are going to be placed there, so you can understand that more pressure now is coming to this hospital, and that's why he felt it's important to kind of find out exactly what are the problems here. Why is there coverage of dirty passages, dirty wards? Why is there coverage of doctors and nurses cleaning floors when there are people assigned to that? He said that he is happy with the presentation done by the MEC of Health, and he stressed that more importantly, now is the time that they put. Let's just quickly go to him now. He's addressing the media. Let's just quickly get to him shortly. Okay, he's going to do the walkabout with the media now at this hospital.
You're going to be hot the whole time, yeah?
I'm going to be?
Hot me as in live on the mic.
Is that so?
Yes. So what you
Okay.
Okay, well, that is the Minister of Health. He's doing his walkabout at the Livingston Hospital, like I said to you earlier on. He's going to walk about and see that the stuff that he's been seeing in the media, that the MEC of Health has said has now been cleared and is no more. Is that really the case? So we're going to talk to him and find out exactly how did the meeting that he had earlier on with health officials, doctors from various hospitals and clinics here, how did that meeting go? And is he really happy that enough work is being done, especially at management level, to address the issues that are facing the Eastern Cape? Another issue, Arabile, here in Nelson Mandela Bay Metro was the issue of deaths. For the past 2 days, the records in terms of deaths were not properly recorded. He did emphasize that it's more critical now more than ever that the number of deaths be recorded concisely, precisely and accurately, because it's such a critical factor in making sure that we get the correct numbers at this time.
But apha eunitini apha kunantsika kule ndawo sidayilaiza kuyo abantu abane-covid bayangena namhlanje siphinde thina singene kulaa ndawo bebengene kuyo kungakhange kuklinwe phaa. Ithini loo nto leyo?
Okay.
So ke ngoku sinaloo ngxaki phaa, because it means loo nto leyo sizawusuleleka sonke mos. Uyayibona yiyo.
Kubani igama?
Ubongane Sam.
Izolo kwi-meeting yethu by the union.
Yes.
Or Princess, or Sweetness, the members, the Imaput kaloku. Oh, Sweetness, i-union yenu inehawu, i-Denosa, i-Hospesa, they raised it strongly. Ubana, let's look at that. We've already sent to quality assurance to go and investigate in the ward. It was raised yesterday.
Good.
Siyabonga. Sizayichecka bese siyayixoxa. All right.
Thank you.
Now, that's just a comment from one of the people that work at this hospital, saying that the people at this hospital are a bit concerned that in terms of regulations inside their wards, the issue of safety has not been guaranteed as yet. So that is the MEC that you see in shot right now, Sindisa Gomba, walking with the Minister of Health, Zweli Mkhize, at a walkabout at Livingston Hospital, a hospital identified as a quarantine hospital here in Nelson Mandela Bay Metro.
Don't go far. We want you to explain.
Minister, we thought we go into the place.
We're working our way inside the hospital. Livingston Hospital identified as a quarantine hospital with full capacity to cater to COVID patients. As you can see right now, we are stopping, and the MEC, the Minister of Health, is asking about issues of sanitation for a long time. There have been burst pipes in this hospital. So where we are stopping right now, as you can see, he's just asking why is there a linking drain in this hospital, and he's trying to find out exactly what's happening there. So the Minister of Health, they're just asking the MEC exactly what is happening here. As you can see in shot now, there's a leaking drain, obviously issues of sewage, and he's concerned about that. So he's just stopped to ask exactly what is happening. Stuff that shouldn't be happening at a hospital, especially a hospital that is housing critical patients of COVID-19. You can see in shot right now that we are showing you just how the effects of this leakage. And that's water coming from the top, obviously at one of the wards, which is a concern to him because, like he said earlier on, cleanliness is such a critical factor, and poor cleanliness is a result of mismanagement, and something that he said earlier on that he's very concerned about.
All the way.
So we are continuing the walkabout with the Minister of Health. He's working his way to a ward. He wants to inspect and see that if the conditions at this hospital are really as good as the Department of Health of the province has said. Because what has been portrayed in the media and what the Minister of Health and what the Minister and the Department are hearing are two different things. So he's here just to make sure that everything is running smoothly, not only hear from the Department, but to see it for himself as well. So he's making his way to the ward. You can see it's a high contingency of media. We are crossing to a ward. You can see there's high media and also a lot of health officials from this hospital who are showing him exactly what is happening, why certain things are the way they are. And every time we stop is because he wants to inquire why things are the way they are.
On that day, it was a preparation of beetroot. So they assumed, because many people sometimes do, and you have a smoke break around this area, it's someone from inside the hospital who happened to be taking a picture of the beetroot that was underflowing through this drain. It was not blood.
When do we
it was never blood. It was never blood. It was drained because immediately Miss Peluza informed us just to come right around ICU. Then we came, we took pictures. We could see it like in different forms because it was just draining out now and again. It was never blood.
So when are we fixing this area?
The kitchen is this area, but this is partly part of
here now. This is not looking good.
Okay.
So when are we fixing this?
I think workshop is informed, but there are processes that they are going through with.
So what are the processes?
I think, Minister, in terms of specification for the company to come and do, specs are being drafted for this, so that at least it could be in a better condition as is.
How long does it take now?
Probably for it to be advertised, it takes plus minus 5 days. But
Can we get the SG?
someone from
Can we get the SG?
from the facilities department can answer.
No, let's get the. No, where's Dr. Matiwan?
Dr. Matuan is here.
Dr. Matiwan. So when are we getting this one fixed?
We've already started the processing, Minister. We should get the company on site by next week to get it fixed.
Next week?
Yes, Minister.
Is there a reason why it has to be a week?
It's just the processing, Minister. We are going to get it fixed definitely by next week.
So, all right, you'd rather give us a date, and then you'll take the photos and send them back to BBC.
No, sir.
You'll send us
No.
the photos so we can see that this thing is fixed.
We will do that because
So
we have
just
the
get a
picture
timeline.
of.
When are we going to send it to BBC?
I can send them today.
No. The fixed one.
Or the fixing.
Yeah,
or
by
after.
Tuesday next week,
It will be done.
we should have it done.
Do you have a team? Do you have a team that's dealing with the rodents?
Sorry?
Yes, there is a company that is on process in terms of our tender processes, but there is a company coming to do treatment of rodents.
When is it coming?
It comes on different days, once a month, but at different times.
When last was it?
I'm not very sure, but I think within a week.
Can we have something concrete so that you see this is something that shouldn't deteriorate to this level?
It's really
Let's get something concrete when the company is going to be here and when this is going to be fixed.
All right.
If we say by next week it must be fixed, and we're saying next week, I want to know what date so that we just show me the photo that it's been fixed.
Okay.
Okay.
You are
so as we're going now, you're going to give me those specifics.
I will.
All right. You can continue reading.
Let us go back.
Going that way now.
Yes. Okay.
Well, that was the Minister of Health just asking about a specific place why it was dirty when it is going to be cleaned. And the lady that works at the hospital said that she assures him that it's going to be clean within 4 days. Obviously raising concerns again of cleanliness and also neglect at this hospital, and he has assured, he's been assured that it's going to be fixed within 4 days. We're still making our way inside the hospital. We're just outside now. And what you saw earlier on was just a dilapidated part of the hospital that the Minister of Health was asking, why is it this way? When is it going to be fixed? And the health official from Riverside Hospital has assured him that within 4 days this issue is going to be attended to and fixed. He asked why it took so long for it to be reported, and he has said that within 4 days it's going to be fixed. So issues of sanitation and cleanliness, another issue that's still an issue here, and the Minister of Health has stressed the importance of cleanliness not only inside the walls but outside as well. We're still on our way towards the wards. We're making our way actually now inside the hospital, and we're making our way inside the wards. The Minister of Health will do an inspection now of how conditions inside the hospital are. This is one of
We'll continue, of course, to give you as much as we possibly can out of the Minister there in the Eastern Cape, in Port Elizabeth, indeed in that Livingston Hospital there, as he continues to try and see the measures that need to be taken in order to keep the hospital safe. Of course, a COVID-19 hospital in particular, one that is looking after COVID-19 patients. The Health Minister, as well as the MEC for Health in the Eastern Cape, that is Cindy Swakomba, doing their walkabout as well of the hospital and trying to ensure the safety of that hospital as well. 66,000 cases of COVID-19 in the province of the Eastern Cape, almost 1,000 deaths there as well, ranking third in the country for the most number of COVID-19 cases. We'll take a short ad break though. After this, we get into your markets.